Maybe one of my friend was yesterday was searching on Google. He found out that he was having a brain tumor.
More than 95% of the time, so 95 to 99% of the times, headaches are benign. But if there is a change in pattern of the headache, then I would be worried about it.
See, if my friend is searching on Google, I should convince him that these are the things he should approach a doctor rather than being searching random things on Google.
So for this, we should remember the SNOOP 4 criteria.
How exactly the sleep can affect a headache?
Lack of sleep might lead to lethargy or daytime fatigue, etc., anxiety, depression. So broadly, headaches are classified into primary headaches and secondary headaches. You know which is the most common secondary headache?
No, sir, just...
It's actually hangover.
Oh, okay.
Yeah.
So I just wanted to know, does these almonds really help in making our memory sharper, or is just a myth?
Okay.
People these days, well, we use AI as well. I just wanted to let everyone know, a random person or a patient who is searching on ChatGPT, and if they will just randomly search, I have headache. But we know what exactly we are searching. Hello, good morning everyone. I am Dr. Abhishek Chauhan. Today we are sitting on the table to discuss few topics which people usually cannot directly talk to the doctors, or maybe not to the superior level consultants. Today I'm sitting with one of the most experienced doctor. Let's just listen from his words who exactly he is, although he doesn't need any introduction. So, hello sir.
Hi.
Good morning.
Morning.
So, sir, please introduce yourself.
Okay. So, I am Dr. Sankalp Mohan. I am a senior consultant neurologist currently working at Fortis Hospitals. I have more than 13 years of experience as a specialist. I have worked in various hospitals of Mumbai and Delhi NCR region. I have worked in government setups. I have worked in private setups. I also have a private practice. So, I have experience in a lot of areas. And my core areas of expertise are headache, stroke, and autoimmune neurological disorders.
Thank you, sir. Thank you for your introduction. I think now the viewers or whosoever are watching us will get a clear picture exactly who you are and what exactly we are going to talk today. So, sir, let's just dig into the topic first without wasting any further time. So, sir, usually many people used to come as a patient or maybe as my friends. They usually ask me, so I'm having headache at 2 a.m. or 3 a.m. Randomly, they will search on Google and they will find out those random results, which they don't know what exactly approach they will follow. Maybe one of my friend was yesterday was searching on Google. He found out that he was having a brain tumor and he was just having a headache. So, so just clarify to the people, especially not just to the people, to the patients, to me as well, because I'm still a resident who is still in the growing phase. I'm still learning. So you know better than you can teach me or guide us through this path.
So I always love to teach, and headache is one of my core topics. So more than 95% of the time, so 95 to 99% of the times, headaches are benign. Most of them are primary headaches. Either it is due to migraine or tension type headache or stress related headaches, or only 1 to 2% headaches are secondary headaches. Okay. And out of that, also a few headaches will actually have a tumor or some serious etiology. Okay. So I am generally not worried if a person has long-standing headaches. He has similar kind of headache since a very long time. But if there is a change in pattern of the headache, or the headache wakes him up at 2 a.m. in the night, or he has sudden severe headache, which we call thunderclap headache, then I would be worried about it.
Okay. Thank you so much, sir. Sir, but see, if my friend is searching on Google, I should convince him that these are the things he should approach a doctor rather than being searching random things on Google.
Okay. So for this, we should remember the SNOOP 4 criteria.
Okay.
If S stands for systemic symptoms, if with the headache, he's having systemic symptoms like fever, weight loss, etc. N stands for neurological signs, like there is a deficit, there's a hemiparesis, there's a cranial nerve palsy.
Okay.
O stands for onset. If it is sudden, severe, or he has experienced the worst headache of his life, then it could be dangerous. So the second O is for older age. If the headache is starting the first time after the age of 55 or 60. And P stands for postural change or change in pattern of the headache, or if there is papilledema on fundus, okay, or it is precipitated by Valsalva maneuvers or cuffing, etc.
Okay. I think these points might help my friend as well who just randomly used to Google, sir.
Yeah.
But okay, sir, let's just talk about the sleep. How exactly the sleep can affect a headache, or can the sleep pattern aggravate the headache? Can you just put some limelight over it?
Yeah. So basically the common types of headache which we have, either migraine or tension type headache, they are definitely affected by sleep. So sleep loss or lack of sleep is a definite trigger for migraine. So it can increase the headaches of migraine. Secondly, lack of sleep might lead to lethargy or daytime fatigue, etc. You might be having some mental changes. You might be having anxiety, depression.
Okay, so I think, friends, these are the reasons I usually told my friends, all the relatives, to sleep on time. That's what even the sir is saying, who is holding a big amount of experience in his hands. Okay, sir, let's just move forward. Apart from this, sir, what are the different types of headaches where we should have those red flags in our mind in order to get the proper diagnosis as well?
Okay, so broadly headaches are classified into primary headaches and secondary headaches. Primary headaches are one when there is no apparent cause for it, like migraine, cluster headache, tension type headache, and there are certain other primary headaches.
Okay.
The secondary headaches are when there are certain reasons for it.
Mm-hmm.
For example, if there's a brain tumor, which everybody thinks, but it's not so common.
Yeah.
Okay. There could be an SAH, which can be very dangerous. Okay. There can be intracranial infection or even systemic infections can lead to headaches. You know which is the most common secondary headache?
No, sir.
It's actually hangover.
Oh, okay.
Yeah. So it's very funny, but we don't consider that as a headache. No?
Yeah.
So secondary headache, the most common secondary headache is actually hangover.
Okay.
Yeah.
That's the reason, I think. But nowadays people love those headaches, I guess. That's why they often used to get drunk every day, mostly.
Yeah.
Sometimes.
But alcohol is important because alcohol can be a trigger for migraine for some people.
Okay.
And secondly, alcohol can worsen a cluster headache. That is very important.
Okay.
Yeah.
But it doesn't mean that people should start drinking just by listening to your advice, I think.
No.
I hope they will not start drinking after listening to you. Okay, sir. After that, I just wanted to make sure first, whenever, even if the patient will come to our OPD or your OPDs, what's your first thought? Like, there we should differentiate in a patient whether we need to get an MRI done for that one particular patient, and for another patient, we usually don't order any MRI or any scans. Do we need to keep some few points in our mind in order to make those differentiation? Because I think we don't need scans for every patient. So do we need to keep these things in mind as well?
Yeah, I think it's the same few points. If there are red flags,
okay,
then definitely you should consider doing an MRI as early as possible. If you suspect that there can be a secondary headache, yes. And in case of change in pattern of the headache, like we commonly have people who say, I have headache since 10 years, I have headache since 15 years, and it is very frequent and very common, then mostly we are not worried about it. But if he says that there has been a sudden change in the pattern of the headache,
okay,
or sudden change in the character of the headache, then maybe it is a secondary headache, or it has transformed into some other kind of a headache.
Okay.
So in that case, you should get done an MRI.
Okay. And sir, is it always that headache is always related to these things? For example, I mean, are behavioral changes, or is it something organic going on? I mean, not just talking about the brain or the spine. Is it something related to any other systemic diseases also, where headache could be the trigger as well?
Yeah. So headache is a common factor in a lot of systemic diseases. For example, fever. Fever can cause a headache. Fever itself can cause a headache. So
Okay.
fever-associated headaches are common. There are various illnesses like malaria, dengue, where headache is a very common symptom.
Mhm.
Okay. So there are a lot of systemic diseases also which can cause headaches.
Mhm.
Okay. So there can be intracranial infections. There can be intracranial tumors. There could be vascular diseases. But yes, systemic diseases also do cause a headache.
Okay, thank you so much, sir.
Yeah.
Sir, before wrapping this small topic, I just wanted to, just ask a random question, which I don't know whether it suits this topic or not.
Okay.
People these days, even we, I think maybe you as well, we use AI as well, maybe different platforms. Okay, so even maybe sometime patients have seen me using chat GPTs or these things. They usually ask, sir, even you are also searching these things on the AIs and these models. But I just wanted to let everyone know, and I wanted to know your thought as well, because even a random person or a patient who is searching on chat GPT, and if we are doing the same thing on the chat GPT, is there any difference doing the same thing on the same platform? Because this is what, like, I want to give my perspective. See, we have studied these things throughout our careers. Okay, so we know what exactly to search. We know the path, what we are searching for and what we are looking for. But the patients who doesn't know, they will just randomly search, I have headache. But we know what exactly we are searching, what we are dragging inside those garbage pits.
Right.
Yeah.
Right. So, for example, you discussed about headache. So, I will talk about what are the red flag signs of headache. So, I will specifically ask that. Or if I want to go more into academics, I will say what are the diagnostic criteria for migraine. Or I will use technical terms. Supposing somebody has a stroke, so I will ask about the guideline for stroke. I will not ask random questions.
Yeah.
Should I eat something in this disease or not?
Yes.
Is almonds okay for brain?
Yeah.
So these are the kinds of questions which a random person would ask. But I would search something which is specific, right? So, or is there any data? Okay, are there trials regarding this? So if you have data, then you can corroborate the evidence.
For sure.
Although you can get all these things also in AI platforms like ChatGPT. You can get good summaries in ChatGPT, but you should know what to search. You search proper data.
Yes, sir.
Yeah, I would suggest that.
Okay, thank you so much, sir. Sir, before wrapping this as well, you just mentioned about almonds. So I just wanted to know, does these almonds really help in making our, memory sharper, or is just a myth?
I would say it is just partially correct.
Okay.
Because almonds do help generally in your nutrition, but there's no specific evidence. Like, almonds will make your brain better.
Okay.
It is generally improving your nutrition, so I would give partial credit to it.
Okay, because yesterday I suggested my friend to eat almonds, but he forgot to eat almonds only. So, so that,
Okay.
yeah. Okay, sir. Thank you so much.